My name is Darartu Abdi, and today I am doing the HEENT assessment. That is for the head, ears, eyes, nose, and throat. And this is for N360 at NDSU. Okay. I'm going to start by just inspecting the head and looking at it if it's midline to the rest of the body, and looking for symmetrical features of the face, like the eyebrows and the eyes. They're symmetrical on both sides. And the nose is midline to the face. And then after that, I am going to palpate your scalp. Okay. I'm going to palpate the skull and kind of feel for any tenderness or swelling or depressions. Do you feel any pain?
No.
No? Okay. That's good. And now I'm going to palpate your temporal artery. That is right here. Just feel that. Okay. And now I'm going to feel your temporomandibular joint. If you can just open your mouth and close. Alright. We got a smooth movement there. And I'm going to palpate your sinuses, your frontal and maxillary sinus. Your frontal sinus is right here. Alright. Do you feel the pressure?
Yeah.
Okay, maxillary sinus. Pain?
No.
Okay. Alright, that is for the head. And now we're going to get started on the eyes. We're not doing a visual acuity today, but I'm going to inspect the external eyes. The eyebrows are symmetric. The eye palpebral fissures, okay, of the same size and symmetrical. And there is no ptosis, and that is just the eyelids, the upper eyelids, drooping of the upper eyelids. So there is no ptosis. And I'm going to just visualize your sclera and conjunctiva. Your sclera is the white part, okay? I'm looking at it, and it's white, glossy looking. And now I'm going to look at your conjunctiva. So if you can just look up, I'll just visualize that. All right, it looks pink, no discharge or abnormal pigmentation. Okay. And now we're going to look at the interior of the eye. So like the cornea and the lens. So I'm going to see if for any smoothness and clarity on your cornea, okay? So I'm just going to light this from the side. Okay, it looks smooth, no shadowing there. All right, perfect. And next I'm going to do the corneal light reflex. So I want the lighting to reflect on the same spot on the cornea when I'm looking at both of your eyes. So you can look at me if you want. All right. I do get the reflection on the same spot on the cornea. And now I'm going to just look at your iris. Okay, it's all the same color and the same size. And pupils now. Let me see what size your pupils. Okay. Your pupils look like 3 mm there size, and the shape is round irregular. As far as reaction to light goes, I'm going to look for direct light reflex and consensual light reflex of the iris. Alright, direct. Consensual light reflex. Alright, on the other side. And consensual. Alright, looks good. Great. And now I am going to see if your pupils can accommodate. Alright? Just stare at me. And then when I tell you to, just focus on my finger that's right in front of you, okay? Focus on my finger. Perfect. I see convergence there and constriction of the eyes on both axes there. That's great. And now I'm going to look at your 6 cardinal movements. So that's going to check for the muscles of your eyes that help move muscles of your eye. So without moving your neck, just follow my finger, okay? Okay, that's great. And now we are going to move on to the ears. I'm going to do the whisper test first, okay? So I'll be right behind you over there. And then hold one of your ears. And you can repeat after me what I whisper to you, okay?
Yes.
All right.
3 and 4.
And then you can hold your other ear.
2 as 3.
Okay, you did great there. And now I'm going to just inspect the outside of the ear. So that's the auricle or the pinna and the skin around it. Okay. No lesions or any scars or anything. Skin looks good. And then I'm going to palpate your tragus and the pinna. Any pain? No. Okay. And no lumps or any swelling there. That looks good. And I'm going to just look at your external ear canal for any discharge, swelling, or signs of infection. And the eardrum, looking for any retractions there. Okay, that's good. The other side. External ear canal looks great. No signs of infection or swelling or redness. That is good. And right now we're going to move on to the nose and sinuses. I've already palpated your frontal and maxillary sinus. So I'm just looking for symmetry of your nose on the midline. Okay, it's midline there and symmetrical. And just checking the skin around the nose. Alright, no inflammations or lesions there. I'm just first let me test the patency of your nostril. So you can hold your you take your index finger and hold your nostril and breathe in, and then the other nostril. Any difficulty breathing with the nostrils? No, okay. So there seems to be no obvious obstruction there. So I'm just going to look slightly in your nose there and look for any deformity or bleeding or just any abnormal discharge. Okay. It looks great, no deformities there, and no bleeding or swelling or signs of inflammation. And now we're going to move on to the mouth or pharynx and the neck. And I'm going to just look at your lips, your hard and soft palate, your gums, your teeth, and all of that stuff in your mouth, okay? Okay, if you can just open your mouth. Okay, the lips look moist, pink. And no cracking, all right? And the buccal here, okay, looks good. So just looking for any redness or lesions. Okay, hard palate. The hard palate looks a little bit more gray than the pink palate. The soft palate is a little bit pinker and soft and glossy looking. Okay, let me look at your teeth. How many teeth do you have? You can relax, okay. Alright, it looks like you have about 26 teeth there. Any missing ones? Okay, right upper cranium is missing. Did you just lose that?
Oh, lasted about a week ago.
A week ago? Okay. And on the left second molar, we have a crown. And I'm going to look at your posterior pharynx, so that's right in there, and the tonsils, okay? And the ovula, that's the one hanging down. So I'm going to use this tongue blade. If you can just take out your tongue as much as you can. Yep, that's good. The tongue looks good and same color all over. So I'm gonna just push it down a little bit, and okay, seems like I don't need a tongue blade. He's doing very good. All right, the ovula looks good, and your tonsils, they're about 2+, so maybe halfway between the tonsillar pillar and the ovula. Do you have any pain swelling? No? Okay. Looks great. And now I can take this off. I'm going to inspect the neck now, okay? So the most important thing I'll look at is the trachea right here. And I'm just gonna, you can just relax, and I'll just look for midline of the trachea, okay? Okay, trachea looks midline and no deviation there. And I'm going to check range of motion of your neck, okay? So if you can put chin to chest, okay, back up, And then if you can touch your ears with your shoulders without lifting up your shoulders, okay? Alright? Right side? Okay, that's good. And if you can extend your neck back. Okay, right now I'm just looking for the thyroid swelling or anything. No obvious swelling here. Looks good, and you can relax. Alright? And now I am, so it seems like you had smooth range of motion there. And I'm going to check the thyroids right now. So I'll give you this water, this cup of water, and sip on it when I tell you to, okay? I'll be right behind you over here. I'm gonna feel that. So if you can just bend your neck down a little, and then a little bit to the right. Okay. And then if you can swallow. Perfect. A little bit to the left. Swallow again. Okay, great. No tenderness there. Swallowed good?
Yes.
All right. I didn't feel any swelling or anything. Okay. Now I am going to check your lymph nodes. Okay. And we have about time to check. So we have the preauricular is right here. Okay. I'm feeling that for any tenderness. Postauricular. And then occipital. Alright. And then submental. Submandibular. Okay. And then we're going on to anterior cervical, no, jugulo-digastric. So that's right here. Okay. Anterior cervical chain, so the anterior side here of the neck, and the posterior cervical chain. Okay. And if you can just relax your neck, and I'm going to supraclavicle nodes here. Alright, looks good. And now I'm going to check your carotid arteries. So first I'm just going to palpate it. So on this side. So we have common carotid artery right here. This is the blood supply that goes to your brain. And then our external carotid artery is right above here. And that kind of supplies your facial everything. Okay, just feeling that. Okay. And now I am going to auscultate your carotid artery for any bruit. Okay. All right, Abdurrahman, I want to thank you very much. And this is the end of our assessment today. Thank you.
Bye-bye.